First, it takes courage to do what these two nurses are doing tonight, risking their jobs to blow the lid on a maternity ward crisis they say could cost mothers and babies their lives. Here's Timothy Clancy's investigation.
She's an experienced nurse who's afraid of being identified, but is more scared someone is going to die while in her care.
Unless things change, babies are going to die. And so are mums.
We'll call her Lisa. She's a special care nurse who works in the maternity ward at Westmead Private Hospital in Western Sydney. Lisa says staffing levels are so low they've become dangerous and lives are at risk.
I'm scared every day when I drive home from work or drive to work that I'm going to end up in a coroner's court because a baby has died on my shift.
There's no doubt this issue is confronting and something you just don't want to hear about when giving birth to your precious child. But midwives and nurses on the front line say it's time. The public, especially new mums, know the truth about what's really going on inside the maternity ward.
There are babies who have had bad outcomes, and when I say bad outcomes, I mean tragic outcomes. They will have a life of disability or they've passed away because they have not been able to be given the care that they need. And I think it's disgusting. I think it's terrifying.
Lisa says she's supposed to be responsible for no more than 4 sick babies, but each shift is unpredictable.
I've had shifts where I've been the only nurse on and I've been looking after 6 very unwell babies with no support on a night duty, and I'm terrified. I would be resuscitating a baby whilst looking after other babies who were unwell and needed care.
The thought of one of those emergencies coming in and you having to leave my sick baby is incredibly scary.
Babies can die if you aren't checking them regularly enough.
An alarming picture, Lisa says she does her best to try and hide from vulnerable parents.
We are like ducks paddling madly underwater and looking cool, calm, collected on top. But it's dangerous and it's stressful and you take that home with you. As a mum myself, I wouldn't give birth in the hospital that I work in.
Renella Fairley is a midwife at Nepean Public Hospital in Western Sydney. She delivers babies and also cares for mums and their bubs on the postnatal ward.
Some shifts we walk out with my colleagues and myself when we're walking down to the car park and sometimes we don't even have to speak. We just look at each other and know that we're all thinking, how did someone not die? Because that's how severe it's got at the moment. It really is a matter of life and death.
These tiny twins spent their first 3 weeks inside the special care nursery at Carina Private Hospital in Sydney's Sutherland Shire. Their mother, Sarah Menterplay, says it was a frightening start to motherhood. She's still traumatised by, almost 2 years on.
Did you feel like your children were safe?
Some nights, no. There were some nights that, no, I didn't feel like they were safe.
Sarah says it was clear the special care nurses were stressed and run off their feet.
Sometimes there could be 8 babies in the special care to one special care nurse. They would often bring in a nurse from the ward and you could just tell that they weren't experienced in that field.
How did it make you feel to see a nurse who didn't know what they were doing?
Oh, awful. Awful. I said to my husband a few times, I feel like they'd be better off at home with us.
While little Lacey and Jet were stable, Sarah says potentially dangerous things were missed.
Yeah, it wasn't nice. I didn't feel like we had, special care. That's what I kept saying. Sometimes we would go in and the tubes would be falling out of their noses. For the fact that the nurse hadn't noticed that the blanket was up over their mouth, that was pretty scary.
There is no uniform law in Australia governing how many patients a midwife or nurse should care for at once. Different hospitals have different patient-to-staff ratios, an inconsistency made worse by different levels of experience.
For example, on postnatal ward, a new graduate midwife could have possibly allocated 12 postnatal women. And the thing that's unfortunate is that babies are not included in the numbers. So potentially that midwife could be in charge of 24 people. And there's no way in a shift that you could give that many people the most appropriate care that they deserve. There's no way that you could do that.
Brett Holmes from the New South Wales Nurses and Midwives Association says 62% of midwives in the state have been forced to reduce their hours to cope with unmanageable workloads.
And if you go home from work every day knowing that you've failed to deliver what those mothers and babies need, that takes a terrible toll on you. And
Brett says the staffing crisis is proving to also have a lasting effect on mothers, with breastfeeding rates dropping 8% in the past 5 years.
That really, from the midwife's point of view, comes down to how much time they've had to be able to devote to educating mothers, assisting mothers, supervising mothers in learning that skill of breastfeeding.
Union bosses in New South Wales are calling for dramatically reduced patient-to-staff ratios, mandated by the government.
There should be a ratio of 1 midwife to 3 mothers. Even then, the midwife is looking after 6 real patients. In a special care nursery, there should be 1 nurse to 2 babies. In neonatal intensive care, we believe that it needs to be 1 nurse, 1 midwife per baby.
In a statement sent to A Current Affair, New South Wales Health said additional staff are rostered on when needed, and professional judgment is used on a shift-by-shift basis to determine staffing levels, depending on the number of babies and how sick they are. Lisa says the private sector is sadly far too often driven by money. Ramsay Healthcare is Australia's biggest private healthcare provider. It has more than 70 hospitals around the country. Last year, the company made $9.2 billion.
It's a business, instead of it being a caring facility.
Lisa says at her hospital, Ramsay charges approximately $1,800 for each baby in the special care nursery per night. She says hiring 1 extra nurse for 24 hours on her wage of $43 per hour would cost the company just $1,125.
Managers are no longer coming from a medical background, they're coming from banking, they're coming from business, and they don't understand that health is about caring, looking after patients and patient safety.
It took several emails and phone calls to Ramsay Healthcare to get their side of the story. In a statement, they say their hospitals focus on staffing levels every shift to ensure patients are safe and well cared for at all times, and that is demonstrated in their published and high standard of outcomes. It's a 1-sentence response that has both staff members and the union questioning, will they ever properly be heard?
My plea to Ramsay Health is to take your nurses seriously. I want them to know how terrified your nurses really are and how stressed they are.
I think they deserve better than that. Women deserve better. I mean, after all, it's for the patient's safety. That's what we're arguing for. That's what we're fighting for. That's what we want to acknowledge. And at the moment, it's not safe.
Full statements from New South Wales Health and Ramsay Healthcare are on our homepage.